Hi, I'm Dr. Francis Chin Kwok Chun. I am a radiation oncologist with Icon Cancer Center. I've been a doctor for almost 25 years with extensive experience in all types of cancer. Good to meet you. So the prostate is a part of the male reproductive gland that sits just below the bladder. Its function is to produce seminal fluid during ejaculation. It is early prostate cancer when it's just inside the prostate, but if it's spread beyond the prostate gland and the seminal vesicles, it is advanced prostate cancer. One of the major risk factors of prostate cancer is elderly age. Other factors include a family history of cancer as well as high testosterone levels. In the Singapore registry, it is the most common cancer for males above 60 years old. Early prostate cancer can be asymptomatic, that's why screening is quite important. You should see your doctor if you experience problems with urination, including but not limited to increased frequency, difficulty in urination, urge in urination, or if you have sudden loss of weight, loss of appetite, or you have sudden back pain. I would recommend that all men get screening for prostate cancer from the age of 45, because when you have early detection of prostate cancer, the treatment is easier and the outcomes are better. Prostate screening usually begins with a visit to your trusted family physician. He may advise a simple blood test called PSA test. A high PSA or prostate-specific antigen denotes usually a chance of it being cancer. It is not necessarily cancerous because other factors include prostatitis or inflammation could be the result of a high PSA. Early prostate cancer can just be treated as surveillance. Some of them will require an operation, which can be an open or robotic operation. But if it is, he may couple it with a physical examination that includes a digital rectal examination where you can feel the walnut of your prostate through the anus. Usually, we can feel abnormal nodules. If that's the case, he may order more tests, include screening, imaging, as well as if there's a high suspicion of prostate cancer, may even refer you to a urologist for discussion of a biopsy. Some of the widespread misconceptions about early screening is that it's painful and is often a painless procedure. Some of the patients who will require biopsy will undergo regional anesthesia and is often just a day procedure and the patient is actually home by the next day. There is a misconception that it will affect sexual function or cause erectile dysfunction. But after treatment, a lot of the patients will actually recover their sexual function and be able to have a normal sexual life after that. One of the common misconceptions is that if I do not have a family history of prostate cancer, I do not need to screen for it. Only 5 to 10% of the patients have hereditary conditions that lead to prostate cancer. The vast majority are due to what we call sporadic or other factors that cause prostate cancer. As Singapore's population ages, it is very important to go for regular screening for all sorts of cancer. We know there is nothing to be fearful of. When you actually screen and detect early cancer, the cure rates are very high because early treatment equals to better cure, better outcomes, and lower side effects.